Hello there. Good afternoon, everyone. Thank you for joining us for today's Lunch and Learn. I'm Renee Young with United Way of Greater Waterbury. It's great to see everyone this afternoon. Thank you for taking the time out to get some wonderful and valuable information. The United Way of Greater Waterbury is happy to partner with Western Connecticut Area Agency on Aging and welcome back SHIP Choices Regional Director at Western Connecticut Area Agency on Aging, Kiara Carchi, who will inform us of everything we need to know about Medicare Open Enrollment and valuable programs and services offered through WCAAA. So at this time, I am going to turn it over to Kiara because she has a lot of great and wonderful information to share with us this afternoon. So thank you for being here again, Kiara, and welcome back. And thank you for everyone who's on today.
Thank you. Thank you, Renee. I hope everybody hears me well. My name is Kiara. Thank you to the United Way team for allowing this opportunity for the program to give all the information and maintain the community informed. My name is Kiara Carchi. I am the Choices Regional Director at the Western Connecticut Area Agency on Aging. I oversee 41 towns in the western part of Connecticut. So today's presentation is going to be a brief overview of what we do, of the SHIP program, also an overview of the Western Connecticut Area Agency on Aging and all of the services that we provide here, and a couple of important dates to keep in mind and add to your calendar. So let's start. I'm just gonna take a moment to share my screen. Okay, so this is sort of like an overview. We're gonna go over a couple of information in regards of Medicare and a key important dates. So let's to the next slide. All right, the 5 area agencies on agents in Connecticut. So every state in the country have area agencies on agents. Connecticut happened to have 5 area agencies on agents, and each one of them handle different regions of our state. So as you see on the slide, we have all the 5 listed there, but the number 5 is the one I work at and the one I oversee. So I oversee 41 towns in the western part, and that's the Western Connecticut Area Agency on Aging, number 5 on the bottom. The rest of the area agencies on agents handle different regions. They have the contacts there. For example, the South Central handles the Greater New Haven and Lower Naugatuck Valley. The North Central handles North Hartford and Tolan counties. The Senior Center resources handle New London, Middlesex, and Windham counties. Southwestern Connecticut handles Fairfield County, and we handle number 5, which is Litchfield, Fairfield, and New Haven counties. Our contact information is also in the table, but I will be providing it also at the end. Aging CT. Aging CT is a statewide network formed by the 5 area agencies on agents we just reviewed. Together, they offer coordinated information, support, and services to assist older adults, individuals with disabilities, and caregivers in navigating aging-related challenges. They offer a wide different variety of services. Some of the programs and services they offer is information and referral assistance, caregiver support, nutrition program, including the home delivered meals, congregate meals, legal assistance for issues like elder rights and benefits, in-home services to help maintain people at independence and remain at home, and many other services offered at the agencies on agents. Another services being offered is the health insurance counseling, and that is provided through the SHIP program. So the SHIP program at the agencies on agents provide them insurance information. So a little bit more about the SHIP program. This is a program that it's available in every state of the country. SHIP services are delivered by the state units on aging or state departments of insurance in partnerships with their local area agencies on agents. Some states call it different. Some states call it CHIP. Some state calls it claim. Florida, for example, calls it SHINE. South Carolina calls it iCare. Connecticut decided to call it Choices, but it's essentially the same program that it's available across the United States. The program was established in 1990 under the Omnibus Budget Reconciliation Act. It has been 35 years offering free unbiased Medicare counseling across the United States. A little bit about the funding. So it's funded by the federal government, U.S. Department of Health and Human Services, then goes to the ACL Administration for Community Living, then goes to state SHIP grantees like state units on aging or insurance offices, and then the budget or the funding goes to the local area agencies on agents or community partners. The program is a federal government endorsed program, and we don't sell insurance, we don't receive commissions, and all of our services is completely free of charge. So it was appointed by the federal government to be the resource for unbiased information to the community. So SHIP funding is provided to each state under the Older Americans Act as formula grants without competition to ensure wide access. In very short terms, the SHIP program is a go-to crew for anything related to insurance, Medicare. Briefly, all of the main core services offered under the SHIP program, it's one-on-one support, simplifying Medicare, benefit screening for assistance programs, open enrollment support, and education and outreach. We collaborate very strongly and closely with senior centers, social worker directors, community providers, to make sure that everyone gets the support they deserve, even hospitals and clinical workers. We're working hard to expand the network of certified counselors across our 41 towns. So we have so far about 48 choices counselors in the region, but we still have a lot of towns that don't have any choices certified counselors in there. We just want to make sure that the city or the town that it's very well represented or it has a lot that they're better equipped with the assistance with the choices counselor. So we're working really closely with the municipalities, town mayors, legislators, and even first selectmen, so we can ask them to identify key people in their community to become choices certified. We're also always on the lookout for more volunteers to join our mission. So now I'll go explain a little bit on how heavily the program relies on our volunteers. In 2024, last year, we helped over 19,000 Medicare beneficiaries statewide. And this is to help them make informed decisions about their healthcare options. And we're always looking to increase the number across the year. So hopefully 2025, the number gets bigger and so forth. How we operate, as I said, we heavily rely on the help and assistance of our volunteers, in-kind professionals who are choices certified counselors, because they are the point person at that community to help individuals with Medicare, Medicaid questions. Volunteers help in very different levels, such as helping during outreach events, conducting presentations, health fairs, preparing for those events, or even being in the office and picking up phone calls and assisting clients with insurance questions. The training and certification, so all the team members, including in-kind professionals or volunteers, they go through a very rigorous training. The training is granted by the Connecticut Bureau of Aging, the State of Connecticut Aging and Disability Services Department. And the regional coordinators, the 5 of us, we're just merely the liaison between the certified counselor and the state. We help ensure that they are continuously updating, getting updates on insurance, trainings, meeting the certification requirements, and things like that. Once the counselors become certified, they serve as trusted community educators, empowering individuals to navigate and understand their health insurance options. They stay up to date on ongoing changes to Medicare, as well as federal, state, and local programs that can help make Medicare more affordable and accessible for those who need it. So they're trained to not only be knowledgeable about Medicare, but also about what's available at the local area to help Medicare be more affordable. They help with screening for entitlement programs and benefits that the client can enroll in. So they go through very intense training to make sure that they are up to date with everything that's required. One of the things that we go out in the community to talk about is open enrollment period. And I'm mentioning this because this time period is from October 15 to December 7, which is, you think about it, right around the corner. It's only about 2 months away from now, and time really flies. So October 15 to December 7, that is the very important time period for Medicare beneficiaries, those already enrolled on original Medicare or those within our Medicare Advantage plan with a drug coverage. Or for those who really missed the deadline to pick a plan or Part D plan, this will be the time period to take action. As we know with any other insurance, Medicare can be very confusing. There's a lot of parts, components. There's some penalties to consider. There are Medicare enrollment periods, different enrollment periods to keep an eye on. There are supplemental plans to think about. So can be very confusing and overwhelming for someone, especially when people get bombarded with a lot of marketing ads in postcards, text messages, emails. During the time period of Medicare Open Enrollment, clients get a lot of these on the mail, email, or phone calls, calling them nonstop. It is a time period where you'll get tons of these pink postcards or green postcards, little ones with very tiny print on the bottom. These are private insurance companies. Just be on the lookout. And it says, call us now, act now, or don't miss the deadline, things like that. Yeah, think about that. Anything that is being offered to you and you are being rushed to take action, you really should take some time to investigate more in research before taking any action. Again, these are private insurance companies and agents trying to sell you a plan or convince you to switch if you're already in a plan. So before making any changes, take the time to review the plan carefully and always confirm that your doctors are on the network or that your prescriptions are in the plan's formulary. Insurance agencies don't have access to your full health history or financial situation, so some may not even be licensed to operate in Connecticut and may be unfamiliar with Connecticut's state-specific rules and protections. So always compare plans side by side and shop around for the plans that truly meets your needs. So and especially your budget as well. So don't be swayed away with the extra perks that normally these extra Medicare Advantage offer, like the over-the-counter cards, the extra money card. You get $35 a month if you enroll in our plan to use over the counter or to use in utilities. Some offer silver sneaker memberships or limited dental, vision, and hearing benefits. So because original Medicare does not offer dental, vision, and hearing, these are the items that they use to sell the plans. Well, we offer dental, vision, and hearing, but a lot of people don't know that these come with a restriction. Limited benefits are being offered. It's not full coverage of dental, full coverage of vision. So sometimes they even have restrictions as to like what type of frames you can use, or you get $1,000 for the year, and that's say you use it, or that if your care needs more than that, you won't be covered. So really look into the plan before making any change. Look closely at the limits, exclusion, the cost sharing details for any added benefits, and ask yourself, is it really worth the switch? The time frame from October 15 to December 7 is to make any changes. And those changes, whatever decisions you made during that time period, will take effect in January 1, 2026. So it's not like it's going to happen next day or next month. It will happen in January 1st, 2026. So sometimes people make the change and they haven't really made the research whether doctors on our network, and come in January, they say, well, my doctor is no longer working with my insurance. Some people are able to switch back and reverse that that decision or that change, but some people are stuck with that decision for a whole new year, and that could be very expensive for many. So we're just here to encourage everyone to take advantage of that time period to learn about the current plan that you have, learn about what's being offered, what benefits does it have, and make changes if it's deemed necessary. We're not here to encourage to make any changes, but if it's necessary, we will help you research. We will help compare the plans. We will help you navigate them, and all free and especially unbiased. So the changes that you can make during the time period will be joining a new Medicare prescription drug plan, joining a new Medicare Advantage plan, or switching from an original Medicare prescription drug plan to a Medicare Advantage plan, switching from a Medicare Advantage plan to original Medicare with a prescription drug plan. So, and this could be very confusing, but you can call us and we can help you navigate both plans. Let's say Medicare Advantage and prescription drug plan. If you're not sure which directions to go to, we can help compare both of them and then check the pros and cons of each. Don't confuse Medicare annual enrollment period with Access Health CT Open Enrollment, which is from November 1st to January 15th for individuals younger than 65. So unfortunately, this time period, kind of overlapped within each other, but there are two different time frames. One is for Access Health Open Enrollment and the other one with Medicare. So the one for Medicare is for those who are over the age of 65 or on Medicare, and the Access Health CTS for individuals that are younger than 65. So why go through this process each year? The plans change what drugs cover each year. The cost of drugs changes from year to year. The Medicare Advantage plans can add or drop providers from year to year, and we want to make sure that your provider is still being covered under your Medicare Advantage plan. The contracts within the plan and the pharmacies, they also change. And there's always a potential to save significant amount of money, whether it's switching to a cheaper plan or a plan that meets your budget, but also your healthcare conditions, but also screening for different programs at state or local level that can help you make Medicare more affordable. Two of the important documents that you should be looking forward to receive or you will be receiving in the mail is the yearly notice of change, the annual notice of change, that it's usually mailed by the plans late September each year. And that is a big packet coming from your plan listing all the changes for the following year. So if you have a plan right now, it will tell you currently you receive these benefits. In 2026, these are the changes. So it will have all in a chart for you laid out, and you want to take a look at that because that will kind of give you an idea what to look for in the following year. Sometimes they don't review those documents, and coming next year you have now a premium increased, or now my doctor's in not a network, or my prescription drug is no longer being covered. So look at that notice, or when in doubt, you can call us and we can also let you know with a plan comparison and let you know what changes are upcoming for the next year. The next document is the evidence of coverage, the Medicare Advantage prescription drug plan and prescription drug plan costs and benefits that go into effect in January 1st of the following year. So basically, it's an evidence that you have that coverage for that time period. So those are the two big documents that you should be on the lookout to receive and actually save those documents. The other ones that are, marketing ads, just do the research before making any changes. What to consider when comparing prescription drug plans. As we know, anyone on Medicare have really two options. Option one is going and sticking with original Medicare, and option two, it's going with Medicare Advantage. You can only choose one of them. You can't be on both. The traditional Medicare, it's composed of four different parts, the parts A and B, then a prescription drug plan, a standalone plan, and then a Medigap policy. Traditional Medicare works on an 80 and 20% ratio, meaning Medicare covers 80% and the Medigap plan will cover the 20%. The option number 2 is Medicare Advantage plan. It's everything combined, basically from the original Medicare A, B, and D, combined into one card, one plan. The original Medicare doesn't offer dental, vision, and hearing. The Medicare Advantage do offer dental, vision, and hearing. So when you're comparing those two options, option 1 or option 2, you always want to ask yourself before enrolling a couple of questions. For example, if you are sticking with original Medicare and you're looking at prescription drug plans, the following questions you should really be looking into it will be, does the plan cover all my medications? Are there any restrictions on my drugs, like prior authorization, step therapy, quantity limits? Some plans will give you only, a 30-minute supply, and other plans will give you a 90-month supply, 90-day supply. Some of them will want a prior authorization letter from your doctor before releasing any drugs to you. So all of these restrictions you want to make sure you are aware of, so you're not surprised, whether when you see the doctor or when you go to the pharmacy. You also want to take a look at how much you will pay in a monthly basis. Are there any deductibles or or what are the costs of the drugs in a yearly basis or a monthly basis? Is the pharmacy in the plan's preferred network? Some pharmacies, believe it or not, are cheaper to go to versus other ones. So if you are also, if you've tried the mail order, also can be an option. So when we compare plans for beneficiaries, we also like to do at least 4 to 5 pharmacies, comparing those pharmacies to, just so the client have an idea of the differences between prices, difference between so again, these contracts changes every year, so we want to make sure they are all aware of that. So you also want to take a look at the plan's rating, star rating. Clients do offer feedback, and if a lot of people just choose branding over coverage, or or over the price, the total amount that they have to pay, and that's totally fine. But you also want to make sure that you look at the reviews, the star rating, and again, if you are able to fill your drugs via mail order, sometimes that's cheaper or sometimes could be expensive, but always doing a plan comparison is recommended. So some of the questions, if you're going with option number 2, which is the Medicare Advantage, some of the questions to keep in mind are the premium prices, deductibles, and co-payments. Are there any out-of-pocket expenses that you're gonna, what are the maximum yearly out-of-pocket expenses to consider? What services area does the plan cover? Some of them are offered only specific regions or service areas, so you want to make sure that you're aware of that. Are your healthcare providers and hospitals in the plan's network? Make sure that your doctor, before switching, before making any changes, call your doctors, call your specialists, and tell them, hey, I'm planning to switch to this plan. Do you participate with this plan? Because then otherwise you'll be sometimes stuck with 100% bill of that visit, and that could be moving forward for the remaining of the year. Are there any rules that you have to follow to access healthcare services, like prior authorization? Sometimes you can't see a specialist unless you have a prior authorization. So same thing, you can get a transportation, you can get some benefits until you get a prior authorization from your doctor. So make sure you're aware of that as well. Does the plan cover additional benefits not covered by original Medicare, like dental, vision, and hearing? So you want to be knowledgeable of the restrictions and what benefits are being offered. So some of the main platform that we use to do the plan comparison, it's the Medicare.gov website, the plan finder tool. This tool, and you can enroll and have an account, personalized account, where you can have a username and password. You enter your prescriptions, and the platform will tell you, this is what you have, this is what's available based on your zip code, this is what's available based on your prescriptions, and so forth. So but some people don't know how to navigate the computer or don't have someone to assist them. They also they can call us, or you can call us to help you navigate the platform and help compare the plans side by side. This platform is the one that we use. We recommend everyone to have a personalized account, because then if you enter more than specific amount of prescriptions and you sign out, or you shut down the computer, when you want to go back to it, you have to re-enter those prescriptions and you have to do all over again. So sometimes it's better if you have an account already set up on that, and we can help you do the setup of the account as well. The phone number to reach us at is 203-757-5449. The option 4 is for the choices department, or the 1-800-994-9422. What's the information that you will need to create a Medicare.gov account? You will need, obviously, your Medicare number, your zip code, the list of your prescriptions, and including your the quantity limits, the quantity, if there's a day supply versus a 30-day supply. You will need to know information such as whether it's a capsule or a tablet or a injection. You will have to have preferred pharmacies, at least 3 to 4 or 3 to 5. And if you're receiving any assistance such as Medicaid, Husky, Medicare Savings Program, so all that information, it will be, helpful to have in order to create a Medicare.gov account. So now I want to go over quickly on how to make Medicare affordable. As we know, with many other insurances, Medicare can be very expensive. It has premiums, deductibles, and things that can be too much for a lot of us. So some of the ways to help this be more affordable is with preventive services through the Medicare Savings Program and the low-income subsidy programs. So the preventative services are basically benefits designated to keep you healthy and avoid illness, such as screenings, counseling, exams for cancers, cardiovascular disease, depression, diabetes, vaccinations like the flu, shingles, COVID. If you're new to Medicare, so you have 12 months from the moment you enroll in Medicare to have a visit with your doctor covered. And that's covered with a Part B. It's not a physical. It's also called the annual wellness visit. It's not, again, not a physical, but it's covered and comes with the new to Medicare bundle. Services available to individuals with certain conditions or risk factors. For example, bone mass measurements, alcohol misuse, screening and counseling, diabetes screening and self-management training, and hepatitis B vaccine. So those are all included under the preventive services that are actually covered by Medicare. You can take advantage of those if you think you qualify for them. The other program is the Medicare Savings Program. Most of you might be familiar with the Great Card, and it's called the State of Connecticut Department of Social Services Connect Card. Some people will say, well, that's my food stamps card, or that's my Husky card. And the truth of it is that it could be both of them. It could be actually, when someone has a Great Card, it could be that someone has 3 of the programs: the Medicare Savings Program, the Husky, and food stamps. Could be one of the programs, 2 of the programs, or all of them at once. The program helps people with low, moderate income pay for some or all of the Medicare cost. So as I say, one of the programs is the Medicare Savings Program. It's not Husky. This is a program, state-funded program. And because a lot of people call it Medicaid, there's been a lot of confusion. They say, well, I have my Medicaid card. Reality is not Medicaid. It's the Medicare Savings Program, which are completely different than Medicaid. Medicaid is Husky, and they're different. The income limits are completely different. The Medicare Savings Program, it's a program, and it's administered by the state of Connecticut Medicaid agency and funded by the federal government. In Connecticut, there are 3 levels under this Medicare Savings Program. One is the QMB, ALMB, and SLMB. Those 3 levels have different income limits, and I'm going to go over them right now. All of those 3 levels will pay for your Medicare Part B premium. As we know, the premium in 2025 for Medicare is $185 per month. Many of those are being paid, normally gets deducted out of your Social Security check. And if you have the gray card is paying for your Part B premium. So it's very important that if you have it, make sure you keep it active. It renews every year. So every year you have to make sure and be on the lookout of expirations. Or sometimes you get the passive renewal notices that it renews every 2 years or every 4 years. So either or, you have to be aware of the expiration date so there's no gap in coverage, because that's what's paying your Part B premium. Only the QMB level will pay for your Part A and B cost sharing amounts, meaning if you go to a doctor or a specialist, there's a copay. If you have the QMB level, the QMB level will be paying that copay for you. If you have the SLMB and the ALMB, those two levels will not pay that copay when you go to doctors or specialists. The gross income from all sources are counted in order to qualify for any of these levels. All levels of the MSP will automatically enroll you in the low income subsidy, which is the other program that I told you you can make Medicare more affordable. It's a low income subsidy, and that is the way to get into the program. It's meeting any of these income guidelines. The income limits that you see in this chart gets renewed every year in March. So, and the program, as I said, is based on funds. So it's always recommended that if you are not sure if you qualify for the program, or if you know of someone who is low income and might not be getting benefits of this program, please refer them to us, or give us a call. We can screen you to see if you qualify for it. It's not based on assets, it's based on income. And if you are single or married, the income guidelines are, different for someone who is married. The other thing is that there's no recoupment, meaning a lot of people think, well, I'm getting this benefit from the state. Most likely the state is going to come back later on to get the money back. And that's not what's going to happen. If there's no recoupment under this program. Once you qualify for it, you get the benefits. And if you, if either the plan, the program expires, or if the program runs out of funds, that doesn't mean that the state is going to then try to recuperate the money that they gave you during the time period they were eligible for. So it's use it what you're eligible to it. So Access Health CT and Husky. I just want to go over this quickly because, as I said, there's a lot of confusion during the enrollment period, and as well as Medicaid and how does Medicaid interacts with Medicare. A lot of people we get a lot of those calls trying to get some information or clarification on the differences. So Access Health CT is the insurance for those not entitled to Medicare, is the market for those not entitled to Medicare. Do not confuse Access Health enrollment period with Medicare. Sometimes it overlaps. As I said, beneficiaries on Husky D need to know they must enroll in all pieces relevant to Medicare and should be screened for the Medicare Savings Program or Husky C, and know that the limits between Huskies are different. So with the pandemic, many beneficiaries were automatically placed on the Medicare savings programs, and some were on Husky, even if they were not eligible. So, and we all know that the public health emergency ended back in 2023, but we're still seeing a lot of people that are undergoing, or they need to go through the process of redetermination and reevaluation, especially with the new changes going at the federal level. There's a lot of changes going on, and the redeterminations and reevaluations are going into effect. So some of the main differences we have here: the Huskies, the Husky A, B, D, C, and LB. There are a lot of them, and they're meant to be for different criteria, different category of people. So, for example, the Husky A, it's for the teens or parents, caregivers, children. The Husky B is for children and teens up to the age of 19. Husky C is for individuals who are 65 and older. Husky D is for individuals who are 19 and older, and up to the age of 64. There's a lot of different levels of Husky LB. LB could be tuberculosis Medicaid program, could be the family planning limited coverage, Husky emergency Medicaid, or the outpatient dialysis. They are specifically, as I say, geared towards a specific condition or specific type of community. For example, the tuberculosis Medicaid program is for those who meet Medicaid criteria except immigration status and evaluation and treatment for active TB tuberculosis. Again, you have to have the treatment is limited for that specifically. The family planning limited coverage is for uninsured or underinsured residents who meet the income requirements, and the family planning services including contraception exams and counseling. And this is not full Medicaid, it only covers reproductive health services. The emergency Medicaid is for residents who qualify for Medicaid, except for immigration status again. And this is only for emergency situations like life-threatening injuries, not an ongoing or routine care. And the outpatient dialysis is those for undocumented residents with end-stage renal disease. And you have to have the other treatments under the dialysis are covered under this Medicaid program. The state expanded undocumented coverage with Medicaid. It's for kids the age 15 to the age of 19, and for pregnant women or postpartum women that need services. So the state funded, it's not reimbursed by the federal Medicaid, but at this moment, up to like today's date, there hasn't been any changes with the Medicaid waivers or the Medicaid Huskies going on right now. And I know that the federal legislation will go into effect October 2026, which is the HR 1. And a lot of requirements will be put into effect regarding Medicaid, such as make sure that they have work requirements in place in order to qualify for any Medicaid waiver. So, but that's coming later on. So up to now, there hasn't been really any changes with Medicaid, and that's why I'm mentioning there are different types of Medicaid, different income limits for all of these levels. And some people say, well, I had Husky all my life. I turned 65. Now I know I'm going into Medicare. All of a sudden, I get my Medicare card, and it's completely different. The coverage is different. The Medicare will always be the first payer. So if Medicare pays first, then who pays second, who pays third? And I'm going to go over that in a minute. Husky C is the level of Husky that we normally work with. It's part of Connecticut's Medicaid program. It's designated to provide healthcare coverage to specific groups of residents. It covers adults the age of 65 and older, individuals with disabilities, and individuals who are blind. Offers services including doctor visits, hospital stays, prescriptions, and long-term care support. It has both strict income and asset limits. So Medicare is not based on assets, but not based on income. So it's basically you turn 65, and if you have specific criteria such as the end-stage renal disease or ALS, then you qualify for Medicare. Or if you have a disability for 2 years, then Medicare becomes effective. But it doesn't have any income and asset limits. Medicaid, it does, on the other hand. The program also provides assistance for nursing home care and home community-based services under the Connecticut's Medicaid waiver programs. Again, different levels of the threshold is very different. So in this chart, you will see that you have the coverage for someone who is on Medicare. Medicare will pay first, red, white, and blue card. Then you have the Gray Connect card, assuming that the client has a Medicare savings program that will cover the copay. And if you have a Medigap plan, the Medigap plan will pay instead of the Gray card. And if you're eligible for Husky, you can also have Husky. So someone with Medicare can also have Husky C as a third payer. So you have the Gray card as a secondary and the red, white, and blue card as the first payer. But Medicaid Husky will not be primary payer at all. It will always be their last resource of payment. And Husky C covers different services that Medicare does not cover. For example, long-term care, nursing home care, home and community-based services, dental care, hearing aids, eyeglasses, medical transportation, prescription copays. Those are all covered under Medicaid. And by combining both insurances, Husky C with Medicare, eligible individuals gain access to more benefits and fill in the gaps. But you have to be eligible to it. So I want to also mention the volunteer opportunity under the program. We're always looking for volunteers or to join in-kind professionals to become Choices certified, so you can go in the community or help the people that you're supporting get the information instead of having them jump through the many loops of referrals or wait online. When they're calling Medicare or when they're calling the state department, it usually takes a long time, but with being a Choices certified counselor, you can get a little bit more of a shortcut and try to resolve those issues for the client, and have and be the point person for them. So feel free to give us a call if you want more information to either join a program as a SHIP counselor or to volunteer. Again, we're not brokers. We're not representing any insurance companies or any plans, so we're not endorsing any of them. We're endorsed by the federal government to give the unbiased information regarding Medicare. The resources available for Medicare is the Medicare U-Book, the official Medicare.gov website, the SHIP program, which again is the federal endorsed program appointed to give you insurance information regarding or assistance with Medicare, and obviously the Western Connecticut Area Agency on Aging that covers the western part of the region in Connecticut. I have provided here with some phone numbers, our phone number, the SHIP statewide phone number, Medicare phone number, Social Security are very important contacts to keep posted in the refrigerator or somewhere handy in case you need to use them. Lastly, I want to go over just to mention that we're having the 2025 Health Expo having on September 19 from 9 to 2. And last year we had it in July. We had over 400 people visiting our health fair, and we're doing it again. The board members loved it and they want to do it again. We're going to have over 50 vendors. If you are a vendor, if you are interested in becoming a vendor at the event, please give us a call. We'll give you more details. If you work with the community, if you are in connection with a lot of people, please share this information. We'll have this event on September 19, again from 9 to 2. We'll have a lot of different things going on, such as health screening, resources. There's going to be a food truck. It's a lot of raffles, giveaways, a lot of good things. So stop by on September 19, add it on your calendar, and share the information. This is our contact information. Again, 203-757-5449. And option 4 for anything that's related to insurance, or press 0 to speak with a representative if you're not sure what department you should be reaching out to. And don't forget, Medicare Open Enrollment period is from October 15 to December 7 every year. So that will be the time frame where you want to make sure you review your plan. And if you have questions, you're not sure how to go about it, call us. We'll help you through it. Now, with that, does anyone have any questions? I hope everybody heard me.
Yes, it was actually great. Thank you so much, Kiara. Wow, there is so much information in comparing Medicare plan variations. It can feel overwhelming for anyone. So we're really fortunate to have you with us today, sharing this critical information and the specific details and how to navigate the process. And thank you so much for the work that you do and your team to help people in our community with this process. The chat is open, and so anyone can feel free to ask a question. But if not, this recording will be made available. We will send it out. It will be on United Way's YouTube. And okay, we have some thank yous coming. Just gonna make sure there's no other questions. Yeah, great. Wonderful information. Great. So thank you so much, Kiara.
Oh, no problem. I'm glad that I was able to, give out the information. And I just love the opportunity, every opportunity I have just to say quickly, don't make any changes on a rush. Please review your plans. Please do research and call us when in doubt. There's a lot of scams and bad people out there trying to scamming or trying to get you on a plan. People that are working on commission. I get it. People have to do their living, but sometimes when it's at the expense of others and it's at the expense of someone else's health, it really bothers me. So I just want to, take every chance I can to express that we're here to support and to give you the information that you need to make your choice, your decision, but it has to be informed.
Thank you for your work and your passion. And I believe we do have one question that is coming through. I was trying to see if I could, I'm going to allow the mic for Tammy. Let's see if she can.
Please, while we wait, just wanted to reiterate, please share the flyer on the expo. As I said, last year we had such a great turnout, and it was the first time that the Western Connecticut Area Agency on Aging had a first health fair last year. They absolutely loved it. We had a lot of people, a lot of vendors, and they want to do it again. So we'll do it. We'll do it once a year, every year from now on. And yeah, so if you want to share, or if you share the flyer, we'll attach to you at same as the PowerPoint, so you can share with your community.
Okay, here it is. I was wondering about those who have reached the age of 65 and participate in the SNAP program, and will they need to go to the DSS to update? Do you understand that question, Kiara?
Yes. So some of the people some of the calls that we get, they are at the age of 65 and they continue with have to have Medicaid or the Gray Card or Husky. It's not, it's food stamps. So that's different. You're probably saying I have Medicaid, I have the age of 65, and I haven't been transferred to Medicare, or I continue to have Medicaid. So my only advice is to, yes, connect with the Department of Social Services and let them know that now you reach the age of 65, that your Medicare will be your primary payer, and that you need to reassess or reevaluate it to apply for Husky C, because up to the age of 64, clients had Husky D. That's a different level, different income limits, different income, asset limits. So you need to be reassessed in order to continue with Husky, a different level, but still Husky. And then the order of payments will be different. Medicare will be first, then Medicaid. But yes, connect with Department of Social Services, or you can call us to the agency, and we'll give you more explanation on why that needs to happen or how it needs to happen. I don't have the phone number with me from Department of Social Services, but when you got your food stamps card or your Medicaid card, you should have the DSS number on the letter.
Wonderful. Okay, I think we're getting one more coming through. Okay, she said, thank you for the information. Wonderful.
No problem. It was a pleasure to be here. Thank you, Renee, for the time and for the opportunity.
Thank you so much. And thank you, everyone, for sharing your lunch break with us today. Have a great afternoon.
Thank you. Bye.